Hello, everyone. Welcome back. So just to give you a heads up of what we're going to do now, we're going to have the Pitch Madness session. So I'll give you all a little color of how this will work. So the Pitch Madness session, what's going to happen is each startup will be given about 3 minutes. I just posted the lineup of the startups. You're going to pitch in that order. If somehow we missed your startup, let us know, and we're going to try to be as efficient as possible. I will give you a few moments I will stop sharing my screen, and your startup will have the ability to share their screen. Again, I'm going to be keeping tabs on the time. If you are approaching, we'll give no more than 3.5 minutes. That's going to be a hard stop. So each of you, I would say 3 minutes, 3.5 is a super hard stop, and I will mute you, and we will go. We will keep it moving. So again, you'll have the ability to unmute yourself when I announce the startup, and then share your presentation. And then that's when you start sharing your presentation. That's when the clock starts. So and then what we will do is on the break portion, what we will do is we're supposed to have our speaker for the break. He's a little delayed, so we'll keep you abreast of it, of whether we're going to do another networking session or not during that time. But I know the founders are ready to go. We're gonna dive right in. So for our first pitch, it's gonna be Limber. So founder of Limber, ready to go? Want to unmute yourself?
Yes, I'm unmuted, and I was gonna share my screen.
Yep, I'm gonna stop sharing mine, and and then we'll start the clock. So you're all set.
Let me know when you're seeing my screen.
Yep, I see the screen. You're ready to go. You have 3 minutes. Go.
Great. So hello, everybody. I'm Michael Gruner, the CEO and co-founder of Limber. We are a digital health solution for musculoskeletal conditions such as low back and knee pain. An approximate comparable is we've built essentially the Peloton of physical therapy. So a way for people to do targeted at-home exercise therapy tailored to their condition. We've seen a gap in the market in identifying those individuals who can self-manage. And so we've created an assessment that segments out those who can self-manage, and then we give a targeted at-home solution for those who can. So the scope of the problem, 1 in 2 adults are suffering from MSK pain each year, 4 times as prevalent as diabetes. Our model is designed for employers and health plans, and we've seen that when factoring in all costs, it's now the #1 cost driver for most employers. On the left side of this chart, you're seeing all those medical costs from physician visits to imaging to surgeries. Low back pain, for example, is a leading cause of opioid prescription, employee missed work days, and unnecessary surgeries. So we know it's a big problem. What can really be done about it? Research shows exercise therapy is that evidence-based first line of care, reduces the need for downstream medical intervention. But we're seeing less than 12% of adults are actually attending physical therapy. Issues are high copays, travel distance, time constraints as well. So with Limber, we've developed a robust assessment, risk stratification, and then for those that pass the criteria, an at-home exercise therapy solution. A model is targeted towards employers and health plans. They pay a subscription fee tiered depending on the size of that organization. It's then made available for free to employees and members. The traction we have to date, we have a Fortune 500 company on board. We're also doing a clinical trial with the Mayo Clinic. So upfront, the app has an upfront assessment. Then we risk stratify individuals based on their assessment. We then provide a program tailored to their injury and their health status. And with that, we've leveraged that Peloton type approach where every video in our program features an expert physical therapist leading a full routine. We also track progress using industry-leading outcome measures as well. And then that gives a summary of the product to date. The co-founding team, we have Dr. Mark Gruner is our Chief Medical Officer, a Mayo Clinic trained sports medicine physician. Dr. Wilsey is heads up our physical therapy programs. He has over 650,000 followers on Instagram for his exercise therapy channel. My background has been in business, also previously worked in Accenture. Some of our strategic advisors include Scott Sirota, CEO of Blue Cross Blue Shield Association. Fiona Gathright leads up a wellness company that is an award-winning company that delivers wellness programs for employers. And then we also have a former senior software engineer from Apple on the team as well. Gives a brief overview. Thank you for the time.
Thank you very much, Michael, since there's a virtual crowd. Here. What we'll do is we'll play your applause. So keep it rolling. Good job. Next up is just a perfect example of Michael was really smooth, came on, stayed in time, and was able to share really quickly. So thank you very much, Michael. So next up, we have Script Health. Do we have Script Health on?
Yes.
Awesome.
Yes.
Great. So I'm going to stop sharing and I'll hand it back to you.
Terrific. Thank you. I will go ahead and share my screen real quick here. Okay.
We got you. So starting the time now.
One moment here. Let me make this big.
Hit play, right, left.
I can't reach it. Give me just a second. There we go. Okay. All right, folks. Thank you so much. So my name is James Lott. I'm a pharmacist and also the founder and CEO of Script Health. And Script Health provides easy access to essential and life-saving medications to improve health. So we've all heard about the opioid crises. Unfortunately, it has a prevalence of about 2 million people who are opioid dependent. But one of the worst statistics that a lot of people are not aware of is that it's taken about 500,000 lives over the last 17 years. And that's really unfortunate because we do have a solution. We have a medication called Narcan nasal spray. It's a prescription medication that rapidly reverses an overdose during an emergency. The majority of insurances pay for it. 80% of the population pays a $20 copay or less. And we know for a fact that it works. Lay people, like anybody in this audience, we've had records of showing that about 26,500 overdoses were reversed when people have this medication. So why is it not available? That's what Script Health is here for. We provide platforms that make these essential and life-saving medications easy. So anyone can go onto our platform, our first platform, which is Naloxone Exchange, the nation's first secure online platform that allows anyone to purchase the life-saving opioid antidote naloxone, receive effective training on how to use it, and we ship it straight to their door. They just do a 3-step process. They select a product, answer a few questions, and our healthcare team reviews it, and then our pharmacy will ship it straight to their door. There is no prescription required. Because of our efforts, we've actually won 2 awards, one from MIT and one from the Clinton Global Initiative for our work. Just a quick demo here. This is selecting a product on the platform. It's very seamless, easy. We have multiple options for naloxone. And the best part is we have a lot more products coming soon. Some of our future addressable solutions are things like EpiPen, PrEP for HIV, and FluMist, the nasal vaccination, which the nasal influenza vaccination, which you guys probably realize is pretty timely right now. So to date, we have basically done a pretty cool MVP. We are signing an agreement with Emergent Biosolutions, the manufacturer of Narcan nasal spray. We've run a pilot with the Healthcare Foundation to subsidize fully this product for people in North Carolina who need it. They just enter in a code on our site and we ship it to them, no questions asked. And we're doing a similar program with the Department of Health in Pennsylvania. We'll be taking insurance fairly soon, and we also have gotten grants from the RAND Corporation, and we're doing a study with them, and also Purdue Pharma. So we know that this market of digital health is ginormous. It's about $120 billion. Right now we're focusing on naloxone, but very soon we'd like to get the investment needed to scale quickly and offer these other medications for manufacturers to get their drugs directly to consumers.
20 seconds.
All right, why now? Because policy is changing, people need access to these medications, and digital health is the solution. Our team is awesome. We are mostly a University of Chicago team. We have strong advisors who've been in the pharmaceutical leaders in the industry, former VPs of Walgreens, the largest generic manufacturer, Teva, and then a very diverse interdisciplinary team.
Well, thank you very much. That was awesome, James. We're going to, I appreciate that. That was great. Great pitch. And now we're going to go on to our next startup. Thanks again. That was great. Our next startup is Tell Health. Do we have Tell Health ready to go?
Yes.
All right, hold on one second. I'm going to stop sharing and then I'll let you share your screen and then we'll be ready to go. Let me know when you're
okay.
All right. And your time is go. Go ahead.
Oh, sorry. Hi, I'm Nicola Nesterov of Tell Health. You can think of me, you can think of us as Slack for healthcare. We provide an advanced next generation telemedicine platform for all care settings. And we're currently working to deploy our solution as part of the COVID-19 coronavirus response. And rather than going through a lot of slides, I'm going to quickly play a short video which presents our core concept. I hope that works. Okay, so that was the video. And back to the slides. So we believe that healthcare communication should empower and give control back to the patients. And our platform works across all care settings and integrates with the electronic healthcare record, which as of this week is mandated by the government, by the federal government. And we've bootstrapped initially. We completed a very successful pilot in a 160-bed hospital. We received positive feedback from over 200 attending physicians. We incorporated in September, raised 160,000 and from physicians. And we are now working on our Chicago Community Hospital pilot. So we are looking to raise 1.2 million to move to the next step.
All right. Thank you very much. We'll great job. We're going to move to the next startup. Right, let's, oops. Next startup on that we have is Sober PUFFIN. Is Sober PUFFIN, is Adam on the line?
Sorry, I was muted. Yeah, this is
Nope. That's good. Just checking. So I'm gonna stop sharing, and then once you're up, we will have the 3 minutes to go.
Okay, give me 1 second. Cue
No
myself
problem.
up. Okay. You let me know.
No, go ahead. You share. You want to share your screen?
Oh, I thought you were gonna do the
I can do it.
Yeah.
Whichever.
Just do the deck. Yeah, I'm sorry. That's what I thought you were preparing for. I apologize.
Nope. No, hold on. Just give me 1 second.
Trying to make it as simple as possible.
Yeah. Either way. So it's loading.
Thank you.
You can see the screen. Yeah. Hold on. Hold on 1 second. I thought you were doing it versus me. One second. All right. 1, 2, 3, go.
All right, so we are Sober Puffin, and my name is Adam Antonucci. I'm the CEO. What we've established within substance abuse community is that there are 1 in 3 families affected, 1 in 8 individuals that are going through the course of trying to get healthy from their addiction, either alcohol or with substance abuse, different drugs. And realistically, right now, the focus has been on treatment of the disease, which is wonderful. And people are getting healthier and not going into overdoses. But what it's done is presented a huge opportunity in the continuity of care model. Because this industry currently lacks perspective, our product is a digital platform that will incorporate the overall picture by onboarding at the starting gate and then picking people up for long-term recovery maintenance afterwards. So obviously with the problem there being established, usually I'd go into a long tirade about how bad substance abuse is. I think we're all pretty understanding of where that disease falls between people having difficulties with relapse and with understanding that they have a problem altogether. Realistically, you have families that are broken apart and you've got overall health that is suffering. And what we're trying to do is teach people that you can get out of this cycle. You can go on to the next slide. Keep going forward. Or actually go back to that one there. What happens every year is that there's about 23 million people that need help. And those that seek treatment are only a small fraction of that. And that's the 4 million people out there. And through that, only about 40% of them stay sober for at least 6 months afterwards. So you can move forward. How do we ensure a lifetime of sobriety? Keep going forward. That's fine. I don't want the clock to eat up my time. So what we've created again is a platform that we like to call Recovery in Your Pocket. Forward. What we have is a private, informative, non-judgmental engagement space. And this is on the front end for those looking to kind of get to understand what the disease is for themselves. They can educate themselves. They can discover what it means to them personally by filling out some filters and going through a couple of questionnaires. And then they can discover what the placement means to them regionally as well as locally. They can also, after they receive treatment or feel that they are ready to go into the community, can see what the recovery community is doing, the AAs, the self-help groups, the 12 steps. And what we've done is we've created this platform that is available currently in the Apple Store. And we've had people on the maintenance side for about 3 months now. We've just started in June of last year. And we've got about 1,100 people. Now, we haven't spent $1 on marketing. We haven't done anything as far as broadcasting outside to about 3 dozen people here in the Chicago area. But the way the community works, what's that?
20 seconds.
Has actually done the work for us. So keep going forward. So the way that we plan to monetize this is to sell a premium version and then also sell the version of the premium app to employees and employers. You can keep going forward. What we're looking to do is build this, create a gap, because there's a lot of people looking for help, and most people don't get their help they need through the traditional way. So we're just teaching them that there are alternative methods to getting help. And that's
All right.
awesome.
Yeah, we're going to have to stop there to be fair for everyone, but thank you very much, Adam. This was great. Thank you for your, you want to contact the founders at the end. What one of the things that we're doing is we will we'll be taking but what we'll be doing is we'll take all the founders' emails and put them on the sites on the site for the event, so you can contact them. So and then also please for all those, mute yourself when you're not speaking, and give me one moment and we will pick the next, show you guys who the next. So do we have Illuminate Health on the line?
Yes, I'm here.
Great, awesome. So I'm gonna stop sharing.
Okay.
And if you wanna share, you are, let me know when you're good to go.
Sharing now.
Let me see if I,
Are you able to see it?
I am. So you're, there you go. 3 minutes starting now, go.
Okay, thank you. Good afternoon. My name is Varun Goyal. I'm the CEO and co-founder of Illuminate Health. A few years ago, my wife and I avoided a potential miscarriage when she was pregnant due to a medication error. And that's what got me passionate about medication safety and helping people take medication safely in the home environment. And so the problem we're focused on is $528 billion per year, where people are not taking the right medications. They're taking medications that interact with another medication that they have, or just confused about when and how to take their meds, and hence having complications, ending up back in the hospital. Health literacy, where it is in the US population, does not help, because it just means not only do people forget what the doctor told them or the pharmacist told them, but once they get home, it just results in more confusion. And at the clinic or the hospital environment, medication administration is not a problem because they have that clinical person there. But in the home environment where the patient is alone or the family caregiver is alone, that's when they need a clinical presence. So the approach we decided to take is using technology to organize patients' medications on their behalf. So, really providing that last mile of translation from the doctor's order, where the doctor might say, Varun, take ciprofloxacin twice a day for 10 days, but I still don't know exactly what that means based on everything else I'm taking. And so we create this schedule for them that incorporates their existing routine into the picture, because research has shown compliance to be higher, and this results in higher efficacy as well as better wellness for the patient. And we proactively do all the medication safety checks so that, people that are taking multiple statins over time can point that out, or we can prevent complications, hence instilling that confidence and trust. And over time, not only to make the digital app more engaging, but also more holistic, what we've done is added the family care coordination piece, where now I can, keep in touch with my dad who's a diabetic, help him monitor his meds. Clinicians can solicit the daily symptoms and side effects that a patient might be having. For kidney disease patients, the app can now tell them to drink plenty of water or get their labs tested on time. For diabetics, we can provide them information on exercising. For substance use disorder patients, we've aggregated a lot of the AA meetings that they can look up in their neighborhood and get that social interaction, all while being connected to their trusted clinicians as this closed system to provide that early intervention and monitoring. We did a successful pilot at Indiana University Health early last year, and it resulted in really good results in terms of user retention, as well as patient satisfaction and staff satisfaction. And so from one hospital, now we're expanding into 4 other hospitals, as well as looking into population health management and pharmacy ambulatory follow-up scenarios. So that's where we are. Would love to talk to you guys more from an insurance perspective, as well as a health system perspective, to help optimize medication therapies. Thank you.
Woo! Great job. Illuminate Health, awesome.
Thank you.
Oh, sorry, you couldn't hear me. Great job. Is Icona on the line? This is our next
You bet,
founder.
Sergio. I am here, and actually it's a little bit easier if you forward the slides for me, if that's all right.
Got it. So just give me a moment. I will, let me get that up and running.
Thank you very much.
Tim will be, it's all right. The audience will get a little breather. Like so many startups. Give me 1 sec. Once it gets up, then we'll start the clock.
Thanks, Sergio.
Great. And you are good to go now. Good. Can you hear me? You good? Tim? Hello?
Hey, Sergio.
Oh, can you hear me?
Got me back? I got you.
Okay, go ahead.
All right, thanks.
2 minutes, go.
All right. Good afternoon. My name is Tim Fitzpatrick. I'm the CEO and co-founder at Icona. I spent 7 years in the U.S. Navy, but my last 2 were actually spent as a patient in the VA hospital system. I had 3 back surgeries and over 500 days of excruciating wound care treatments, but I finally healed. And a couple of years later, I met my co-founders, who are both neurosurgeons and virtual reality filmmakers in New York. They'd completed a really interesting randomized controlled trial where they tested the effectiveness of VR as a familiarization tool in the clinical setting. Now, 3 years later, working in the space, we're tackling one of the greatest needs and challenges in healthcare today. Slide, please, Sergio. Great. Kidney disease affects 37 million American adults, and it's the 9th leading cause of death in the US. Slide, please. Recent legislation aims to shake up how and where we care for these patients with kidney disease, and specifically those patients who are candidates for dialysis or transplants. Just 12% of dialysis patients today are currently being treated at home. The new law requires 80% of patients to be treated at home or to receive a transplant. But here's the problem. Patients already have these options today, but the educational tools they have available to them clearly are not supporting their abilities to make those decisions effectively. Slide, please. So we asked nephrologists how they're currently educating their patients about kidney disease and their treatment options. And it turns out that nephrologists wish they could spend more time educating their patients. The vast majority are either providing written handouts or they're relying on brief conversations. And they're spending far too much on ineffective materials and videos. Slide. So virtual reality is changing the ways that we are able to educate patients. And so far, we've seen that 36% reported an average knowledge increase across all of our modules, 47% increase on average in staff confidence, and 80% of our users are preferring VR learning to traditional media like online video or text. Slide, please. So we tested this in dialysis clinics and it went even better than we had hoped. Frontline staff became more confident, patients loved learning with VR, and they're actually able to make better decisions because of it. Slide, please. Our mission is to educate 1% of the 37 million Americans with kidney disease by 2025. Slide, please. Okay. So we're expanding our impact in this space, and we're now operational in over 200 dialysis clinics across the country, with many more to come this year. Slide, please. We operate on a recurring revenue model with monthly subscriptions to our content. And on the direct to provider side, we also have a one-time fee per patient. Slide, please. Yeah. Using a bottom-up projection, we estimate our obtainable market to be around $11 million while focusing on our existing enterprise pipeline and also growing a secondary go-to-market strategy further upstream with nephrologists and primary care. Slide, please. Our team's incredibly diverse.
Well, I'm going to have to stop there. That was excellent. I know that was about 3.5 minutes. I know it was a little chunky with this, but great job. Excellent. And again, a lot of the founders, their contact information will be on the website as we move forward. So so stay tuned on that. So the next startup we have is Renalis. Renalis there?
And
Can I see that in there?
Yeah.
Yep.
I'm here.
Did I pronounce it?
Yeah, Renalis is close. How do I advance the slides, or do I pull up my?
You could pull it up and share if you want.
Okay. Yeah, let's do
Share
that.
screen. Yes. So for all the other founders listening, we can.
Got it.
Yep. There we go. There you're driving, and we're gonna do. We'll start the clock. Right. Hold on 1 second. Go. You're good.
Hi. Okay, thank you. At Renalis, we're going to eradicate the inefficiencies and dramatically improve the patient-provider diet and pelvic health. Why? So 75 million Americans suffer from pelvic health disorders. These conditions are chronic, expensive, and embarrassing, so much so that it takes a patient 7 to 12 years before they actually bring this up to their doctor, and then 4 times doing that before they get treatment. Providers complain they're overwhelmed with basic education and counseling, frustrated with non-compliance, spending significant time on staff for unnecessary follow-up. So this is where we come in. My grumpy patient experience allowed us to build a nonprofit that's related, that has a groundbreaking program called Total Control based in behavioral therapy. We're gonna build off of that into our product launch. Where is my advancing? Okay, sorry. So basically, let's talk about this. It's not a women's condition, but we're starting with women because that's the biggest bucket. So 1 in 3 women will have these conditions. These are the ones we're focusing on right now. Our 6 major categories all have, they bleed or leak into the major population health issues that we're thinking about as a country. And it's damn expensive. So over $100 billion. We're starting with overactive bladder because it's about 67 billion of that $100 billion. So in the current state of pelvic health care, extremely inefficient in all of the 3 Ps, as we call it. Everybody's looking for a better way if we're going to both cure patients, but also make the providers more efficient. So providers are saying things to us like, I don't even know what happens to my patients. They leave, only 30% of them, and that's high, even come back. I really need some help. So that's great. Let me introduce you to CC. So think about CC as your personal pelvic health coach or personal pelvic physical therapist in your pocket, like you're texting to your best girlfriend who's a nurse practitioner. So CC manages the patient journey, therapeutic journey from initial visit all the way through her care pathway, learning from her as she interacts, tailoring the experience with AI to optimize her outcomes. For the practice, CC curates the data, sends only the customized alerts that are necessary for follow-up or to indicate when advanced care might be necessary. The goal is really to center the patient in her own care, give her the tools and support to get the right therapy for her and meet her goals, stay connected to her provider, improve her health, lowering healthcare costs. This is a representative patient journey with a big emphasis here on follow-up visit for point number 1. Our goal at Renalis is to be the leading prescribed digital therapeutic. We're relentlessly focused on FDA approval. We think we'll get in front of the FDA this time next year and get the green light to go ahead. Our product pipeline, we've got an SBIR funded for menstrual health, fibroids, and endometriosis. We're leveraging off of that to build our go-to-market platform in bladder health. We just got a huge strategic partnership signed yesterday that's going to allow us to hyper speed all of that and have some ARR to boot and a great platform to launch from. So right now, we're really focused on the proof of concept study in OAB. So we've got sites identified and we're really building out our content in depth. So here's our revenue growth, a huge blue ocean of market. We've got competitors, but it's really pen and paper. Our team is immersed in both pelvic health, software, strategy, and launch. We are raising $1 million. We'd love to have anybody who's interested join us in trying to really shake up pelvic health care in the United States.
Amazing. Great job. Great timing. Woo! All right.
Thanks, Sergio. And this thing's going to keep going. Stop. There you go.
Hey, Sergio, you're on mute. We can't hear you.
Okay, so
Oh, there we go. Jordi, are you Opportunity? That's you?
yes, I'm.
Great. So are you going to present?
Yes, sure.
Okay.
But I see your screen.
Yep.
Should I
Go
share my?
ahead. You can do the
yes.
share. You can share your screen now.
Hey, Sergio, can you mute all lines? We hear some background.
Yep.
I
Got
got some
it.
problem.
I think it's his line. Oops.
I don't know what's happening.
Jordi, you're back on. You want to share your screen?
Yes, I want, but I cannot.
Okay. So since you cannot, I'll drive. That's why we have the presentations ready to go.
I think I can now.
All right,
Hello?
Jordi, I'm gonna share my screen, and you'll have, once it's up and running, you'll have 3 minutes. Just give me 1 second. All right, Jordi, you ready?
Yes, I'm ready.
All right, 3 minutes starting now, go.
Hello, everybody. I'm going to show you Opportunity, the social networking platform for the social globalization. Move on, please. Despite the world we live in, where the cultural and economical globalization and the hyper-connected we live in, there is no social globalization at all. There are lots of people moving around, but there is almost no social interaction in places like airports and stations. Please. In these kind of spaces, you used to be alone, mostly, I mean, business travelers who used to go to lots of events and also love to meet people, but it's not a good place to meet random people. Please. We want to make of airports, stations, and public transport the new agora, places where to connect business travelers, non-profits, academics, students, volunteers, investors, whoever, for whatever, for leisure, pleasure, business, by sustainable development goals, events, and communities in commons. But the biggest challenge is to reach critical mass in order to connect two users in the same place at moment. So we are going to focus on events and communities. We want to add more value to your events in order to increase your attendees and keep them connected after the event. So it's basically an end-to-end networking platform based on communities, events, and purpose. Please. We make it thanks to our web platform and apps, and also an API, which allows to implement this feature in any kind of app. Please. The user experience is quite simple. You just need to create your community, profile, events, and role. Every role generates a unique invitation link, which can be sent to all these people in order to invite them and make them be part of the event or community. Once the user receives the link, they just need to update the profile, update their event strip, relate it with the event, so they can start connecting to other attendees going and coming back to event. And of course, in the future travel, it will be considered as a match point. Please. As a user, it's quite simple. You just need to sign up, update trips. find opportunities and continue connecting, please. There are thousands of other networking apps for events. We want all them use opportunity, please.
20 seconds.
Business models are obvious: premium features, ads as a social media, and API integration. Please move on. We are a bootstrapped team. Please move on. We have a very small rate, a large team. Move on. And we are ready to launch since last week. And the coming months are going to be to validate target, channels, and value proposition in order to scale. Move on.
All right. Well, thank you very much, Cody. This was excellent. Thanks again. And the founder, again, to contact the founders and hear more of the rest of the pitches, do check the website as we go. But so the next founder that we have on the line, do we have Aid Bank? Maf, are you on? All right, it's the first miss that we have. Second Keys.
Hey, Sergio, can you hear me?
Yep, I can hear you. So Second Keys, who's all right.
It's Mark. How you doing?
Got it. So Marja, I'm gonna unshare. Let me know once you're ready to share. All right, sharing screen. Boom. All right, you ready?
Yeah.
All right, 3 minutes starting now. Go ahead.
Hi, everybody. I'm Mars. I'm the CTO of Second Keys, and we simplify the process of filing maintenance requests. So for renters and landlords, poorly handled maintenance issues can lead to a bottomless pit of lost time, money, productivity, and turnover rates, especially if that issue is preventable. Now, we've all had a complicated maintenance problem with an apartment. Your AC goes out or your toilet gets clogged, and sometimes it takes weeks or months to get that fixed, if at all. And that causes a lot of tension. So much, in fact, that 68% of renters say that their main reason for leaving a property are issues due to maintenance. And that causes property managers over $5 billion nationally. And as the renter population continues to grow, this problem can only get worse. While Second Keys is here to solve that. We eliminate the guesswork in property maintenance by providing a software that uses end-to-end ticket tracking, so no more phone or email tag. We have predictive analytics. We use data to predict when that appliance will actually break in your home. And we have a qualified contractor network to help get bids for that property quickly at a competitive price. Our goal is simple: to help property managers and renters live better, manage better, and work better. Now, unlike our competitors, our API-driven software structure actually allows us to give our competitors an integratable and modular experience. And only $5 per month per unit, we're able to, that gives us a market valuation or market potential of over $3 billion in just maintenance alone. Essentially, our value prop is simple. We want to turn a $5,000 repair bill and an angry customer into a $50 expense and a minor inconvenience. Now, our team, we have over 100 years in real estate development experience and over 200 years in technology, and we worked well together. So well, in fact, that we were #3 startup and startup of the year for 2019. We are associates of the Google for the Black Founders Exchange, or Google for Startups. We were the top 10 tech startups, property technology startups of Memphis, Tennessee for both 2019 and 2020. And today, we have over actually 2,000 units on our platform who have seen savings costs of $312 per unit, or even increase in ticket results of up to 30% when it comes to closure rates for those tickets. And we, of course, we're, as I said, space startup, being the only woman-owned or minority-owned property technology startup in the U.S. to date. And we just want everybody to understand that the first key to successful property management begins with the person, but the second key is a management software that cares. So thank you.
Great job, Mars. Appreciate that. That was excellent. We have our next.
You're muted, Sergio.
Why does it keep muting? I don't understand. Well, no, thank you. Thank you, guys. Thank you, Mars. That was excellent. Next, we have Finite Games. Do we have the founder for Finite Games?
Yes, I'm here. Jamari's here.
All right, great. I'm going to stop sharing, and then I'll let you pick it up. So, great.
Share.
Let me know.
Share.
All right, everyone, stick with us. We're almost at our two more, and then we're gonna do a networking session. So we'll take a different sort of break. It won't be a break, but it'll be some motion. All right.
Am I sharing?
I don't see. Wait, I know it's loading. And if this is loading, we're gonna go. All right, 1, 2, 3. Good. You're up.
Good day, one and all. My name is Jamari. Tell people good way to remember Jamari on Safari and his Ferrari. Jamari, I'm introducing you to Finite Games. At Finite Games, we're really looking at how can we actually create a new vertical in the casual esports gaming arena. We're really focused on mobile, and we're looking at how we can use blockchain-enabled technology to create new experiences, not just for the players, but also for advertisers and people interested in branding. So we believe that by creating these finite experiences using digital assets that are being branded and used in unique ways, we can actually create a marketplace for players and advertisers to be able to have new forms of sponsorship and also new exciting forms of gaming. So I'm going to introduce you a little bit more to what that model looks like by our first demo. But first, our team. There's me. I recently exited from the quantum resistant ledger, which had a $100 million valuation, and I helped build out the underlying core mechanics of that, as well as I've worked with social enterprise in the past, and I'm a engineering public policy background from Carnegie Mellon and Howard University. I also have a serial entrepreneur and blockchain developer, Whitney, as well as Haley Shavers, who has worked on smart contracts. And then specifically, what does this look like? What does Finite Games build? The easiest example is Ro-Sham-Bo. Imagine rock, paper, scissors. You're playing a game, except for it's not the same as normal. You just can't throw out anything you want. You have a set number of cards. Let's say you have 12 or 9 cards. So we'll say 9, 3 rocks, 3 papers, 3 scissors. And as you're playing your matches, you have to dispose of the cards that you use. But in addition to that, the back of those cards are actually owned by you. So therefore, you can actually auction off the ownership rights of the art to the back of your cards to companies and to organizations to be actually a sponsor for their branding. So not only are you now becoming a part of the brand of an organization, but you're also playing inside of a changing strategy game where as you start decreasing the number of cards, your strategy has to change. So you now have this meta and micro type of gaming experience. So this is what we're trying to build using blockchain-enabled technology. We're trying to provide ownership to our users, finite experiences that have some type of end to them. Because when you have an ending, when there's some kind of stake, when there's ownership involved, it really raises the sense of value, the sense of care, but it can still be a casual, fun experience. And with casual games being actually 80% of the gaming environment and over 70% of game players on mobile being actually people who play these types of games, we know that this is really the target and the vertical we should be focused on and build out technology. So what does this business model look like? So for our games, we'll first have a starter pack where you kind of start off with a set amount of cards, and then you can kind of get this freemium model, but then you can actually pay these up to $1 for, or as low as $1 for more cards that you run out. Because remember, these assets are discrete and they're finite. So as you use them, it's kind of like gas. You have to get more gas to continue forward if you're interested. And then you have to take a small transaction fee. And then on the higher level, on the esports side, it's this esports events branding model. Because you actually have these reduced set of finite cards and digital assets when you play, you can now change it to say, okay, hey, we're going to create tournaments from this set of cards. Hey, I'm going to offer my cards up to create these tournaments. And you're creating these unique opportunities for players to be able to engage with branders and to actually increase their presence, but still play something that's straightforward, simple, and enjoyable. So here's our process we're looking for. We're going to finish Rock, Paper, Scissors, Elite, have our finale tournament this summer, then have an Oregon Trail type game called the Pilgrimage, where all the assets are in that game are discrete finite, and move forward from there.
Thank you very much. We're going to have to stop there.
Oh, no, that was excellent. Thank you.
Thank you very much.